Hello, my name is Shamaya Thompson. I'm going to be doing an examination today on your wound. So I'm just going to ask you a few questions. We're going to do a systems review and we're just going to go through the rest of this examination process, okay? So the first thing that I want to ask you is, when were you first aware of this wound? Okay, so your family member told you that you have a pink hole on the bottom of your foot. Okay, and they found a pebble in your shoe about 2 weeks ago. Okay, so did you seek any additional medical treatment for your wound at all? Okay, so you saw the doctor, they gave you wound dressing, some medication. Okay, is your wound painful at all? Okay. Sometimes. All right, do you feel any sensation in your feet? Do you feel anything in your feet at all? No? Okay. What type of shoes do you usually wear? Oh, okay. Okay. So you've been wearing the same sneakers for 10 years? Okay. And they don't have good support, you said? Okay. All right, so just looking at your past medical history, I see that you have type 2 diabetes, or you had type 2 diabetes. So this has led to some loss of sensation in your extremities, because typically diabetes can actually lead to a loss of sensation. So perhaps that may be why you didn't feel the pebble in your shoe. And I also see you had a kidney transplant about 4 years ago. So this was due to a lack of blood regulation in your kidneys, which has also kind of altered blood regulation and has probably led to some of the issues with wound healing that you are experiencing, okay? You also have hammer toes through digits 2 through 5, which has led to issues with your mobility. So you said that you're not really moving as much as you want to be moving, okay? So now I see that you're on some medication. So you're on insulin to control your blood glucose levels. You're on hydrochlorothiazide, which controls high blood pressure. You are on losartan, which controls high blood pressure as well. And you're on cyclosporin, which prevents organ rejection. So you're taking that because of your kidney transplant. Okay, so next I'm going to just run through a couple of questions just about your functional mobility, recreational activities, and so forth. So do you use an assistive device for mobility, such as a cane or a walker? Okay, so you use a cane around the house and outside. Okay, do you currently work? No, does not currently work. Do you engage in any physical activity? Okay, so you like walking up and down the hallway in your house, but due to your lack of mobility, it's been a little bit hard. Okay, do you have any hobbies? Okay, so you like reading. Okay. What is your current diet? Do you eat fruits, vegetables? Okay. So potato chips and soda. Okay. So based on your answers, moving forward, I would like to work with you on some functional activities just to help you around your house. I also want to work with you on gait training just to help you with walking, with moving, because that's really important for blood circulation and blood flow throughout your body, okay? And that may help with the wound healing process as well. And I also want to engage you in some aerobic activity. So this could be just walking up and down stairs, walking around the house for a little bit. So moving forward, I would like to implement those things for future treatments. And I might possibly refer you to a dietitian, just because I believe they can help you with improving some of those eating habits, because we want to make sure that you're eating fruits and vegetables and things that will actually help your health and help your overall quality of life. So the next thing that we're going to do is we're going to do a systems review, okay? So I'm going to check your cardiovascular system. So doing this, I'm going to check your blood pressure. Okay. Now I'm going to check, actually I'm going to document your blood pressure. Okay. Now I'm going to check your pedal pulse, which is on your foot. Okay. Now I'm going to just check your breathing. I'm just going to assess how many times you breathe per minute. Okay, I'm going to document that. Now I'm going to check your range of motion for your foot. So okay, I'm going to document that. Now I'm going to do a manual muscle test for your dorsiflexors. So hold. Okay, now we're going to test your plantar flexors. Hold. Now we're going to test your toe extensor. Hold. And your toe flexors. Hold. Okay. Now we're going to check your GI system. So this is just me checking just to make sure. Do you have any abdomen pain? Or if I palpate here, does it hurt at all? No? All right. Do you experience any heartburn? No? Okay. When was your last bowel movement? Okay. Have you been having regular bowel movements? Okay. Now I'm going to just palpate your kidneys a little bit, because I know that you've had kidney transplant. I just want to make sure your kidneys are okay. Have you been experiencing frequent urination at all? Okay. Now we're going to check your neuromuscular system. So I'm going to just check your sensation really quickly with a monofilament. Can you feel that? No? Okay. Now I'm going to check your ankle reflexes. So I'm going to check your Achilles tendon. Can you feel that? All right. Now we're going to test your balance. So I just want you to stand up without a cane. All right. So that was your balance. So now we're going to check your skin. So I'm going to just check the peri wound. All right, I'm going to check the size, the shape. I'm going to check around the areas. All right, so I'm going to go even more in depth. So the next thing that I'm going to do is I'm going to measure this wound. So it looks like this wound is on the plantar surface of your right foot. So it's near digits 2 and 3 on your foot. Okay, on the plantar surface, which is your weight-bearing surface on the right foot. So now I'm going to measure. And if you want, you can get a little bit closer just so you can see. So I have my measuring tape here. So I say this is about 12 o'clock here, 6 o'clock down here. So I'm going to take the longest length that I see. I'm going to line up my measuring tape with that. Okay, you can get a little bit closer so you can see for yourself. I'm going to say that this is at about 1.5 centimeters from 12 o'clock to 6 o'clock. And now I'm going to do the width. So I'm going to find the widest part. So I went from here to here, so we're going to just go perpendicular to that. So from about 3 to 9 o'clock, we're going to say that that is 1 centimeter long. 1 centimeter in width. Okay. So I'm going to document that. All right, so it looks like your wound bed is pale, it's pink, slightly red, not a lot of granulation tissue going on there. And your wound edges look like they're even, a bit of a punched out appearance here. The edges are a little bit rolled with a white outer rim. And there is callus surrounding that wound edge. And for your peri wound, it looks like there's some dry skin around here with callus. I know that you have hammer toes between digits 2 and 5. So it's there, and you've been dealing with a little bit of wound exudate. Okay. So based on the appearance of your wound exudate, it looks like you have thick, opaque exudate on the inner side of your wound dressing and a minimal amount of exudate on the outer aspect of the wound dressing. And so there was also some drainage on the wound bed after the dressing was removed. So with all of that information, I'm going to say that you have a moderate amount of exudate coming out, just because that there was very thick, opaque exudate on the inner side of the wound dressing, but on the outer side of the wound dressing, there was a minimal amount. So overall, you have a moderate amount of exudate. So based on the thick, opaque appearance of your wound exudate, I am concerned that your wound may be infected just because of the thickness, the opaqueness of it, the moderate amount of exudate that you do have. Even, after I remove the wound dressing, I am a little bit concerned about it being infected. And overall, I'm going to say that this looks like it's a neuropathic ulcer to me. So that's what I see. I see a neuropathic ulcer, and moving forward, we will continue working together, and hopefully we will heal this wound. And thank you for coming to my office today. Have a good day.